and co-founder. It is Friday, the day after Thanksgiving, but it is also in the middle of a pandemic. So Dr. Michael Fine is kind enough to join us today. We've got new numbers, obviously from the holiday, but they begin to paint the same picture that we've been suffering through for the past few weeks. And also want to update on vaccinations and where in the state the disease is hitting the hardest. So let's start with the numbers, Dr. Fine. Obviously limited testing, about 6,800 tests conducted yesterday and 463. So if you standardize that for an average day of 20,000 tests, which has been our baseline here at GoLocal, you're looking at around 13 or 1,400 positive cases.
Yeah, I think that's right. And, we don't have a feel for the mix of asymptomatic to symptomatic testing, but the numbers are still worse than we want, with one exception. The good news from today is that hospitalizations went down to 219. I hope that will be a trend, but I suspect it's an artifact of the holiday, of reporting and of people who just want to get through Thanksgiving, whether they feel sick or not, and won't go to the hospital till Thanksgiving is over. So I would expect on Monday, unfortunately, that we will be in the 360s to 400 range. I hope not, but that's my guess. 6 deaths overnight, 5 the day before. That's not as bad as we were seeing, and I hope that trend continues. But again, I fear and believe that we're going to be in the 15 to 20 range every day before long.
Yeah, I mean, listen, all the reporting is off significantly, obviously, because of the holiday. The New York Times today had 100,000 new cases. On average, for about the past week to 10 days, we've been running in the United States about 170 to 190,000 new cases. Secondly, the number of deaths reported yesterday across the country was right about half of where the trends have been going. The one thing, national number, that is obviously deeply disturbing is, for the first time, reporting off of yesterday, the number of hospitalizations in the country was over 90,000.
Yeah, and before long it'll be over 100,000. Hang on to your hats. This is going to be a pretty uncomfortable and wild ride.
Yeah, it was interesting. As you scan social media yesterday, obviously there are a lot of folks who took the warnings seriously and stayed at home alone. But there was obviously lots of folks who said, "Oh, I'm just having this family group over. We're not having 30 this year. We're only having 6 or 4 or whatever." So that's problem number one with the level of infection we have. Number two is we were out at the Walmart in Providence this morning at 4:30 in the morning, not to buy a big screen TV, but to see what the level of crowd was. And there was a good 100 people teed up for the 5 o'clock opening. And they were somewhat distant from one another. They seemed mostly to be wearing masks. I don't think they could get in the store without a mask on. But you had 100 people who don't know each other all lined up, in about 200 feet of line. Also, they're going to go into a store. Whether they keep their masks on in the store, we don't know. There'll be some enforcement, obviously, in the retailers, but it's not a good practice to be able to control this virus.
No, it's not at all. I mean, I wish everybody just stayed home today, as I wish they stayed home yesterday.
Dr. Fine, let's talk about the complexities of the vaccine. There's been initially good news on 3 fronts, Pfizer, Moderna, and then this Oxford AstraZeneca vaccine. In less than a week after the Oxford AstraZeneca was first announced, it was supposed to be one that didn't have the complexity of temperature control in transportation. It was much cheaper. It had a number of benefits. The data seemed to unravel, and lots of questions are now emerging. Your thoughts on where we are with these 3 potential vaccines, and especially the concerns about what Oxford AstraZeneca announced?
Sure. Well, I think, and I said this before, that and there's been some public discussion of this now, that I think the AstraZeneca vaccine they're gonna have to redo their phase 3 trial, and I would like to see them redo it do a couple of them. One, as you know, they by mistake sent out a half dose and tested a couple of thousand people on the half dose and got better results, surprisingly, on that group. So they're going to have to test that half dose for a full phase 3 trial, I think. And then I think because the results they got on the rest of the group were not so good. They only got about a 60% efficacy rate. I think they need to test it as a 3-dose vaccine as well as a 2-dose. We'll see how that all translates, but I think what that means is we won't see AstraZeneca in the market till April or May. And we'll have to see how that works. The good news about AstraZeneca is that it's relatively easy to store and transmit. So that gives it one foot up. The other 2 vaccines, which use a new technology that have done phase 2 trials, have better numbers, but one of them at least is particularly difficult to store. Needs to be stored at minus 94 degrees, and I'm not sure we really have the infrastructure to deliver that widely because of that constraint. I'm also hearing some early reports, more in the realm of rumor than in published reports, that as many as 40% who get it have real trouble. Just a day or two, but a day or two of headache and nausea and vomiting, and a low-grade fever, that kind of thing, enough to take people out of work. And we'll wait and see if that proves out or not, but that may be an additional challenge to this new technology.
Yeah, I think it's obviously critical that this isn't driven by corporate press release of these major pharmaceutical companies, that it's driven by the science, and that the FDA plays its proper regulatory structure and does the proper due diligence, because the worst possible thing could happen is that a vaccine that is not ready to go to market goes to market and undermines any governmental credibility in regulating vaccines in the future for this virus or any others, because there's enough public distrust as it is. Let's jump over to cities and towns. You've run the numbers off the new data from the state. It paints numbers that I don't think any of us 2 months ago really would have comprehended of how far the virus has gotten in many of Rhode Island's cities and towns.
Yeah, these are big numbers. The state's average now is 570 new cases per 100,000 per week. That is 5 times where the governor wanted it to be when we first started talking about this number.
And let me also state, that's 30 times where you think the state's average should be.
Actually, it's 100 times where I think the state's average should be. I want us under 2.
2 per day, 14 per week.
Yeah.
30
I
times.
got the week translation messed up, but 30 times more. We are way higher than where I'm comfortable with. The little bit of good news is that the rate fell in Central Falls by about 10%, but Central Falls is still the most infected place in the state. And there's a magnification effect when you go to 100,000 in a city of 20,000. So I'm not sure that change is really that statistically meaningful. The troubling thing is there are now 8 places that are above 500 cases per 100,000 per day, I think, and 10 places that double. So we're seeing really big numbers in Providence. In the 7 is almost 800 cases per 100,000 per week. In Providence, in North Providence, in Pawtucket, in Smithfield, in Warwick, in East Greenwich, and in Cranston. Cranston is now, I think, third in the state after Providence. But in our Warwick, 591 cases, above average. So 8 places where cities are above the state's average, and there are most populous places. And the 10 places that are doubling, have doubled in the last week. Uh, include Barrington and East Greenwich, and Burrville and Coventry and Exeter and Lincoln and North Kingston and North Providence and Smithfield and Warwick and West Greenwich. So spread out over the state is this process of doubling. And that's in 2 weeks. I'm going to look really hard at what happens in a week when we get next week's numbers, because I'm really worried that some of this will start happening, will be doubling in a week.
Yeah, Dr. Fine, the numbers are just through the roof. And remember this, for folks who are watching, the baseline of not allowing schools to open, and that was Central Falls, Pawtucket, and Providence, they were partial openings, not full openings, was a baseline of 100 new cases per week. And all of those cities are now 5, 6, 7, 8, 9, and 10 times higher than that. This is, we're now in the midst of something that I just don't think folks ever anticipated during this period of time. And it's been the lack of controls and the lack of discipline and the lack of restrictions. I mean, the governor's going to a partial shutdown. She likes to call it a pause, but it's a partial shutdown of some businesses, yes, and some businesses, no. I mean, the realization is we've got disease through the roof, and big box stores got them lined up at 5 o'clock in the morning for people to go mingle with each other and fight over big screen TVs.
Yeah, 23 communities are over 300 new cases per 100,000 per week. 23 of our 39 communities. You can't say that it's in one place, and you can't say that small changes are going to stop its spread very much, I don't think.
Dr. Fine, we're not really going to have great data until Tuesday or Wednesday of next week. We're gone through, obviously, Thanksgiving, which I think everybody is worried about what the implications of that will have on spread, coupled with a big retail day. Even if it's a diminished retail day, it's still a lot of people in cars, at shopping centers, in malls, etc. We're going to have 2 events literally back to back. Hospitalizations are above 300. The governor announced Thursday that all COVID unit beds are already full. She's triggered the activation of one of the field hospitals in Cranston. What do you see for the next 3-4 weeks?
Well, one place of caution, and that is I think people really need to be careful starting Sunday and Monday, because the incubation period's 5 days, but people start shedding virus when they become newly infected 2 days before they become symptomatic. So that's sort of 3 days from Thursday and Friday. That's when, if you're ever gonna start staying home and staying out of stores, and you haven't started yet, certainly start by Sunday, because my guess is there's going to be an extra amount of virus floating around in stores and in any place where there is public gathering, because of Thanksgiving and because of today, because of what's called Black Friday. And then I see, where probably about 1,500 new cases per 100,000 per day. My guess is by Tuesday, we ought to look at, but probably closer to 2,000 per 100,000 per day. And unless we do something radically different, I see that doubling in about 2 weeks. So I expect us to be, in the 5,000 to 6,000 new cases per 100,000 per day, certainly by the end of December, if not before Christmas.
Dr. Michael Fine, thank you for taking the time on this pseudo-holiday to join us and keep us informed. For everybody else, stay tuned for tomorrow. We'll have a story about how well the new rapid testing that the state is deploying works, how the positives and false positives and false negatives impact the test results. So we're talking to some experts and we're digging into the data on that. Stay tuned on that. Also, stay tuned for some updates by GoLocal this afternoon. Everybody, stay safe. If you can stay out of the big box stores, please do it. By the way, support the local guy. Wait till everybody clears out of his or her store and walk in by yourself with your mask on and your glasses on. And if you got to go into a store, try and buy local. Everybody stay safe, wear your mask, keep Rhode Island moving forward with a little bit of discipline. Thanks, everybody.
Thanks, Josh.